I'm Alicia Goggins, and today I will be telling you guys about venipuncture, also known as drawing blood. Okay. First of all, this topic has always interested me, and after I got into it, I realized that there are a lot of people that just feel like they can do a lot better than the person that is nervously standing there sticking them 3 times. So today I'm going to explain this process to you so you know exactly what's going on. Okay, the first step is you want to identify your patient. The last thing you want to do is stick the wrong person, okay? The second thing you want to do is introduce yourself. You have to let the person know who you are and what you're going to be performing, okay? Next, you want to wash your hands and put on gloves. This is the most important step in this process, okay? You don't want to get the person sick, and gloves will protect you from whatever the person may have, if anything. Next, you want to verify the test that you have to perform on your intended subject. Okay. This is going to help you when you gather supplies because there are particular tools that, tubes and needles that you need for certain blood tests. Okay. Next, you want to position your patient in the chair while you apply your tourniquet. Now, this is a tourniquet and it's quite simple. And all it does is restricts the blood flow and kind of pumps up your vein so that you are able to get a good stick. Okay. Now, next, using your index finger, you want to look for a vein. One of the things they teach you is veins are bouncy and they feel like a sponge. So when you press on it, it kind of bounces back, and that's when you know that you have a good vein. Okay? And when you find that vein, you want to anchor it with your thumb because veins do tend to roll. Okay. Next, you want to perform your stick at a 30-degree angle, bevel up. And when people say bevel up, needles, needles are not straight. They're slanted at the end, and there's something called a bevel, which is the hole, and this wants to be up so that you get a good blood flow. Next, you want to insert your tube, the correct tube, so you can collect your blood. And in blood collecting, there are certain tubes that you would use first because of the different additive ingredients. Next, you want to release your tourniquet. And something that's very important is you never want to leave a tourniquet on a patient's arm for more than 1 minute. Okay. Next, you release the tube that has been inserted into the needle, and you want to invert it at least 6 times. And the reason you invert it, which is basically just turning it over itself, is so the additives that are in there can mix. Sometimes there is a coagulant that keeps it from clotting, and there are other drugs in some of the tubes that are used for testing. Next, you want to apply gauze over the stick site. Now, it's very important in this step that you do not press and hold the gauze because the needle is still inserted into the patient's arm. Now, after you place the gauze over the arm, you want to remove the needle, immediately applying pressure and asking the patient to bend their arms so that they don't bleed out. Now, it's very helpful at this step if you ask the patient to hold the gauze while you activate the safety device for the needle and immediately dispose of it. There was a time when these measures weren't in place and people were constantly sticking themselves with needles and catching diseases and, re-sticking patients with them sometimes, which was a really big problem. Okay. Next, you want to apply a bandage over the person. Well, make sure that the bleeding has stopped and apply a bandage. You also want to make sure that you label the tubes with the appropriate labels. Okay, this is very important because a lot of times if you don't label it and you get backed up, you can mislabel it and you'll have to recall in all your patients to get their blood work redone. Okay, next, you want to remove your gloves and wash your hands. Like I say, this is a very, very important step. After and before, every time you put on gloves, you always want to wash your hands. Okay, and the last step is you want to make sure that your patient is okay before they stand up. There are times when patients will stand up too quick, get dizzy head, and pass out. And that's always very bad. Okay. Now, in conclusion, while it seems like a very complicated process, for the people or for those of us that do it on a daily basis, it's quite simple. But a lot of times where the confusion comes is if patients are difficult or if they're uneasy. So the next time you go to have your blood drawn, the best thing you can do is have confidence in your in the person that is sticking you, and just be at ease and be relaxed, and it'll be a more pleasurable experience for everyone.